It's a good act, but the implementation of that is not that good.
Laws may be put in place, but that does not mean that they trickle down to the community. Public hearings may have been held, to get consensus around issues of abortion, but that consensus may not necessarily have been representative and cannot be representative of the entire nation.
South Africa declared August Women's Month, and as you know, the 9th of August is celebrated annually as Women's Day. Whereas the focus throughout the month will be on important issues such as, amongst others, celebrating women in the fashion and film industry, we will, on this show, focus on women's health issues. Now, we kickstart this month with a rather contentious, but nevertheless very important subject affecting all, but mostly young women. Despite the fact that abortion is now legal in South Africa, indications are that serious complications, including death related to unsafe and illegal abortions, are on the increase again. It is really painful and hard to understand why we should be having this problem in the first place. Could it be that legal and safe abortion services are not freely available to most women? Or is it that illegal methods are more easily accessible, discreet, and less embarrassing for these young women? Well, stay tuned, because these are some of the questions we'll try and answer in today's show. We will, with the help of a panel of experts, learn more about abortion or termination of pregnancy, or TOP as we popularly know it as, why women opt to go the illegal and unsafe route, and more importantly, what other options are available to these young and vulnerable women. Now, our panel of experts include the person in charge of women's health within the Department of Health in South Africa, a midwife highly experienced in TOPs, and someone from the well-known Mary Stopes in South Africa. So sit back, relax, and learn from this exciting show ahead. By the way, you can be part of this show by calling us with the questions of you on Johannesburg 714-6843, 6847, or 6857. Or interact with us on our Facebook page, SABC Health Talk, or Twitter at SABC Health Talk, including, of course, our email address, healthtalk@sabc.co.za. I'm Dr. Sello Mutaung, and this is Health Talk.
Abortion is a process of ending a pregnancy by either using medicine or a surgical procedure. Every year worldwide, about 42 million women with unplanned pregnancies choose abortion, and nearly half of these procedures, 20 million, are unsafe. If you are thinking about having an abortion, it is important that a doctor should evaluate you. Only a trained medical profession such as a doctor or a nurse can perform an abortion. But a lot of women seem to opt for the illegal and unsafe way of aborting, as the trade of illegal abortion is still common in the center of the city. The city is crammed with posters offering safe and pain-free abortions. Women, and mostly teenagers, have abortion for different reasons. Some because their pregnancy was unplanned, some as a result of financial challenges they are facing. Despite abortion being legal in South Africa, women in the Johannesburg CBD and elsewhere still opt to buy abortion pills in the streets. What has been seen in some cases is fetuses being bottled up and tossed at the dump site. Women's health advocates argue that illegal abortion in South Africa are thriving due to the poor public health services.
Are you practicing, doctor? What are your qualifications?
This leads to desperate young women subjecting themselves to dangerous procedures in dirty environments to rid themselves of unwanted pregnancies. At this time, they do not pay any attention to their health, but are more worried about what their peers and parents will say. In the meantime, the health department is about to embark on a massive family planning program to reduce the number of unwanted pregnancies, especially amongst teenagers. This will hopefully go a long way in curbing the problem of illegal and unsafe abortions.
Okay, so we've heard a lot about this abortion, but what exactly is abortion? If it can be regarded as an illegal way of ending life, can it be equated to murder? How different is it from the so-called miscarriage? Well, let's put these questions to our guests. First up is Dr. Manala Magua, or Dr. Mokgalagadi Magua, who's Chief Director for Women's Health and Genetics at the Department of Health in South Africa. Welcome to Health Talk, Dr. Magua.
Thank you, Doc.
All right, and we also have next to her Sister Sharon Peter, who is a midwife based at the Charlotte Maxeke Hospital here in Johannesburg. Welcome to Health Talk, Sister.
Thank you.
All right, perhaps let's start with you, Dr. Magua. We're talking about abortion and, you know, what exactly do we mean by abortion? What is the formal definition of abortion, if I may ask?
Thank you, Doc. The abortion is the word that is being used outside the health facility, because from the health perspective, we're talking about termination of pregnancy. And termination of pregnancy can be done by choice, according to the Act, or it could be a medical indication for the need to terminate the pregnancy to save the life of the mother.
So, Sister Sharon, I mean, is it now popularly known as termination of pregnancy? Are people still using abortion? What's your experience?
People no more use the term abortion.
Right.
Yes, even our patients, when they come in to request,
Right.
they will tell you, I'm looking for the termination of pregnancy ward.
Okay.
I want to do a TOP.
Okay. So it's us in the media who still use this abortion word. We're quite backward, aren't we?
Yes.
All right. For this show, we'll try and, you know, if we can, use a lot more TOP rather than abortion. But now there's the legal side and the illegal side. Can you just take us through what is legal in this country insofar as termination of pregnancy is concerned?
First of all, for termination of pregnancy to be defined as legal, it means it's been formally requested and then it is performed according to the prescripts of the Act of Termination of Pregnancy,
Right.
2008.
Right.
What is illegal? It's any procedure that could happen outside the health facility and not according to the prescripts of the health.
Okay. Sister Peter, there's the issue around when it can be done. We hear 12 weeks, we hear 20 weeks. Please clarify us.
A termination of pregnancy can be done up to 12 weeks on request
Right.
of the pregnant woman.
Right.
No questions asked.
Right.
As long as the pregnancy is up to 12 weeks.
Yeah.
If she comes in to request, then the service is provided to the woman.
Right.
And then from 13 to 20 weeks,
Right.
it's done only in the cases of rape, or if the pregnancy poses a risk to the pregnant woman,
Right.
or if the pregnancy poses a risk to the fetus that is growing inside the woman,
Okay. So generally we're
or
saying
due to socio-economic conditions.
Right. So anytime up to 20 weeks, it can be done.
Yes.
But recommendations are that, it should be done by the 12th week or before the 12th week.
Yes.
All right. So clearly, I mean, this show we're going to be talking a lot more about the unsafe abortion, the so-called backstreet abortion. Dr. Magua, this is a problem that this country faces. Do we know the extent of this problem?
Definitely not. The reason why we are saying we do not know the extent of the problem is, much as there are sporadic informations and studies done in pockets in the country of saying there is an increase in the number of backstreet abortions, formally we do not have the formal numbers that would say this is the statistics of backstreet abortion.
Yeah, but the fact is that they do happen.
Yes.
And a lot of young women actually die from this. Some of them may not actually die in hospital, but some of them may actually die at their homes, for that matter. Sister, you obviously deal a lot with the safe ones. Do you encounter any of the so-called backstreet abortions, perhaps, somebody that would have started the process somewhere else and then ending up in hospital? Your comment?
Yes, we do a lot.
Yeah.
Because right now, the pill that is used for abortions is easily available from the streets. It's being sold on every corner of Johannesburg.
Yeah.
Maybe you notice in town Johannesburg there are street adverts about free, safe abortions and the cell number at the bottom.
Yeah.
So that is where our women get the tablets.
We're gonna get back to that because that's obviously one of the things that promote backstreet abortions. But we're gonna get that. But why should we worry about backstreet abortions? Are there any dangers? Why should we even say that they're unsafe, sister?
Yes, because once they get the pill from the streets, they take the pill and then they go home. They are not in the hospital. They are not looked after by trained medical staff. So whatever happens at home, they can complicate at home, like they can bleed a lot. There could be injury to the womb. Like for instance, if she received a high dose of the pill, it might lead to the rupture of the uterus or the womb. And then she will bleed at home, and then she will complicate.
And this is where the problem is. I mean, some of them actually may bleed to death at home if they don't make it in time to the hospital, isn't it?
Yes. And then the other thing is that even if the pregnancy is expelled from the uterus, the placenta will remain in the uterus. The fetus will be expelled, and then the placenta will remain in the uterus, and then it will rot, and then it causes infection. And then the woman will still be at home, not going to the hospital. And then it will lead to sepsis. And then by the time she gets to the hospital, maybe she might end up losing her womb because of the infection and the severe bleeding.
Yeah. Dr. Mokua, obviously, I mean, being in charge of women's health, this is a problem. Do we kind of have a sense? I mean, I know that it's difficult. We don't have actual figures, but we kind of have a sense of the burden of, backstreet abortions in our public facilities in terms of, those that report with incomplete terminations that have gone wrong, septic or bleeding and so on. Your comment?
Yes, much as we agree that we do have some challenges, but there's a lot that has been done within the Department of Health. But obviously the problem as it is now is not solely for the Department of Health. And I'm just happy that today now you've raised this. I think you also created a platform for us to jointly with other sectors to deal with the problem. Because one critical thing that would help us is identify the people who are offering such a service.
Yeah, we'll get to that, Dr. Mokua. I mean, I guess I'm saying this is a problem. Hospitals are inundated with other health issues already. And I mean, if now we're going to be adding on to the burden, this problem of incomplete abortions that are going septic and going wrong, clearly it must be stretching the resources that are already limited, isn't that so?
Yes. Yes, definitely, because you would understand that someone who has undergone such a procedure would end up now being an emergency when he gets to our health facilities. And you can understand that having to deal with an emergency now already, that in itself puts a strain on the resources that we already have that are very limited. Okay,
well, let's hold it there. Now, we ask the question, who's likely to opt for a backstreet abortion and why? Well, we find out after the break. Please stay with us.
An investigation is now underway to establish whether the men were involved in other crimes. One of the men has also been linked to another shooting 2 weeks ago where a police officer died.
This is the strongest reading since October last year. New orders led to a rise in output for the first time since November. This means that the first quarter could have ended with a new high momentum that's likely to get carried into the second quarter.
An increase in oil supply from that country is likely to increase global oversupply of oil, and that in turn should spell continued lower oil prices.
We saw that really with the adjustments in the fuel price, both in March and now in April, that consumer inflation is bottomed and it will start to rise slowly going forward over coming months.
For all your business news, stay tuned to your favorite channel, SABC News, at 1 Monday to Friday.
Welcome back. Now, on every second lamppost, wall, or telephone booth around the city, it's not uncommon to find advertisements like safe and painless abortions. Now, some of these so-called doctors offer these services for as little as 300 rands. Now, backstreet abortions are a thriving business on our city streets. And why is this still happening in a country where abortions are legal? Well, let's understand more from our guests. We still have Dr. Manala Makua, Chief Director for Women's Health and Genetics within the Department of Health. And we have Sister Sharon Peter, a midwife based at Charlotte Maxeke Hospital. We're still with you, Dr. Makua. Talking now, going back to this problem of backstreet, abortions, all right? To say, let's try and understand, my belief is that you can only deal with the problem if you know what's causing the problem. Let's try and understand why is it that women opt to go this illegal route?
Thank you. I think it's very complex, and I think we would all agree that it's actually called choice of termination of pregnancy. And immediately you give people a choice, then you are saying nothing is obligatory and nothing is mandatory. So what actually happens is the services are available in the department. Yeah. The services are free. They are not for 300 rand. They are for free. They are also safe, not only painless, but very safe in the health department. So the issues of now saying why do they opt to go for payment and painless, not necessarily safe, that's the question that we'll put out there to the community to help us understand the complexity of an issue. But definitely, what we would understand is our health facilities, although the services are free and available, some are still not accessible. Accessibility in terms of the operating times, for an example. But we are doing what we can at our best in the health facilities to make sure that the services are available when they are actually needed.
Well, the one criticism, Dr. Makua, is that perhaps the demand for, let's call it, choice of termination of pregnancy is higher than, what the department can afford to be stretched. In other words, the resources available within the Department of Health cannot meet the demand for people that, choose to terminate their pregnancies. Is that a valid criticism?
I may not agree.
Right.
Because if you listen to the duration that one has, it's about 12 weeks. And if you visit any of the facilities that offer it, you will not find a waiting list.
Well, let's find out from one such then. Charlotte Maxeke is one. We were just chatting off air just now about how many of these. Perhaps just share with us how many such terminations of pregnancies do you do at Charlotte Maxeke?
At Charlotte Maxeke, we do between 120 to 140 per month.
Right. So this is well over 3,000 terminations in 1 year. And just what sort of, gestational period do you deal with?
Mostly we deal with 13 to 20 weeks, but sometimes because Joburg Gen is designated to do second trimester TOPs, but sometimes we do get first trimester TOPs, which is the ones that are up to 12 weeks gestation, the complicated cases.
Yeah, we have a caller on the line, but before we take that caller, do you have a waiting list?
Yes, we do.
And how long is your waiting list?
It's about 3 weeks.
3 weeks. We'll get back to that. I wanted to take note of that, Dr. Makwe. But for now, let's take a caller on the line, Tisetso from the Free State. Tisetso, welcome to Health Talk.
How are you?
Yes, your comment or question, please.
Yes, my issue is relating to the delay in the times that women take before they are actually assisted at public institutions. Often waiting lists are extremely long, and by the time that an actual abortion has to take place, that woman is already past the period where an abortion has to take place. That is why most of the women opt to go to these unsafe abortion institutions.
Okay, thank you very much, Tisetso, for your comment. Very valid comment, and it talks to what we're talking about, really.
Yes.
Waiting lists and some of the reasons why women get pushed the wrong way.
Can I clarify the issue? We're talking about the second trimester. I think Sister made it very clear that they are doing 13 to 20, and the reason and the indications are very different from the ones that are just choice because there was an error or there was a failure in a method.
Yeah.
So I think we need to separate the two, because if it's that second trimester, then it's medically indicated, there's a screening that needs to be done, there's a lot of processes that needs to happen.
So Dr. Mukwa, you're saying that it appears that the demand is a lot higher from after 12 weeks, between 12 weeks and 20 weeks.
Yes, because...
And such that the department can't cope with those women between 12 and 20 weeks.
Let me put it this way. In the first 12 weeks, there's no waiting list because you don't need complicated medical equipment or there's not a lot of screening that needs to happen. But from 13 weeks, remember now we're doing it for saving life purpose now. It's no longer just for the termination of pregnancy because it's unwanted. Yeah. In that regard, there are processes, there are procedures, and there is also a possibility of a need of complicated resources that might be required, such as an operating theatre. And in that regard, therefore, automatically, you would then have a situation where we have a waiting list.
Sister Peter, let me put you on the spot a bit. I know your situation, you deal with what you deal with. Do you want to perhaps just comment on the capacity of all health facilities? We can talk about Joburg because you get referrals from these centers. Their capacity to deal with terminations before 12 weeks. Can you comment on that?
At Joburg Gen, we do get referrals before 12 weeks.
Right.
But the referrals that we get are the complicated cases.
Okay.
Like, for instance, women with medical conditions,
yeah.
Women who have had previous cesarean sections.
Yeah.
Yes, those are the ones that we get.
All right.
Let's
move on to this other issue then, that, there's a perception that public health facilities aren't that, for lack of a better way of putting, discrete places where, a woman that, has chosen to terminate the pregnancy can confidently go to without the chance of being seen by anybody else. And for that reason, that's why some of these young women opt to go the backstreet route. Your comment?
I would still say it's, like you're saying, is an opinion of the public, and we reserve the right for the public to say their opinions. But definitely the system is not in such a way that when you walk through the main entrance, you'll be asked, what are you here for? And then you're made to say, I'm here for termination of pregnancy, and therefore that issue of not respecting privacy and confidentiality would come into place. But in the way the health facilities functions is you would need to have privacy and confidentiality. Then you can at that point say what your need is and the service you're requesting.
Let's ask Sister Peter, is there privacy at these clinics? Just now you said to me, when these patients come, they come looking for the termination of pregnancy ward. Isn't that so?
Yes.
So this is a public facility.
Yes.
So you can't really hide it, can you?
No.
But okay, before you respond, we have a caller, Mauricio from Mohale City. Mauricio, good morning and welcome to Health Talk.
Good morning, sir. Good morning. Thanks for taking my call.
Yeah. Your question quickly?
Yes, I just want to ask, why does the government don't make any alternative way so that people must not completely make abortion? If we've got hospitals, if somebody's got a problem for that, then they just take him to the original hospital. And another thing, if somebody gets pregnant and no parent, that means if the father of the child says not him, then that thing it makes the girl to get angry that must take the make abortion. Why they don't make a plan that if the girl get pregnant and the boyfriend is refusing, they must take the boyfriend and the parent of the boyfriend and the parent of the girl to the hospital and make the blood test. If they get that blood test for that guy, then the both parents, they must support that kid. While they must allow to kill the kid instead of supporting the kid.
Okay. All right. Thank you, Mauricio, for your question. Rather complicated one, but perhaps some of them not quite relevant to what we're talking about. I think, he's raising issues, around what should happen to the person that is responsible for that, making that girl pregnant in the first place. Why can't they be charged and so on? But I want to come back before we go for a break, sister, to say some of the criticisms leveled at public health facilities is that, they stigmatize the whole question of, people that choose to terminate pregnancy by the questions that, they get asked by the nursing staff, for instance. Your comment?
I don't think we ask such questions that stigmatize the whole thing. The questions that we ask the pregnant women are relevant to the termination of pregnancy.
Okay. And it's not done in public in such a way that it embarrasses people?
No,
okay.
Not at all.
All right. Let's just hold it there because unfortunately we have to go for a quick commercial break. Now stay with us because after the break, we now look at contraception and family planning. Don't go anywhere.
This is not a road, it's an invitation. This is not driving, this is carving. These aren't bad conditions, because there's no such thing. Okay, this is treacherous, but so what? This is not a mountain, this is the next level. All conditions are perfect conditions. The new Audi Q3.
Welcome back. Now, it is reported that half of all pregnancies in South Africa end up in abortion. This raises the possibility that some people may in fact regard abortion as a method of family planning. If they could indeed be misinformed, what contraception options are available for them? We're going to explore this with a lot further with our guests. And perhaps let me introduce a special guest that joins us for this segment, Whitney Chinongwenya, who's Marketing and Communications Coordinator for Mary Stopes in South Africa. Welcome to Health Talk.
Thank you for having me.
All right. And of course, we still have Dr. Manala Makua, and I must correct that, not Chief Director, but Director for Women's Health and Genetics in South Africa, Department of Health.
Thank you.
And of course, we still have Sister Sharon Peter, based at Charlotte Maxeke. Now, before we carry on with our discussion, I believe we have a caller on the line that's Innocent. Innocent, welcome to Health Talk.
Oh, yes, sir.
We're good, sir. Your question or comment?
All right. Okay. My question is, a woman can make a TOP more than once under the circumstances of she is not ready. I want to hear that.
All right. Thank you very much. Now, an interesting question here. Now, I think there's two aspects to the question. Firstly, whether or not it is possible for one person to have termination of pregnancy more than once, and whether or not it should be allowed in the first place. And I think the other bit is why it should be like this in the first place, which perhaps will, talk to what we're going to be discussing in this segment. Isn't that so? All right. Do you want to just comment on that quickly?
Yes. Termination of pregnancy is not in any way a form of contraceptive.
Right.
That is what we need to understand.
Right.
We do have a wide range of contraceptive methods, and we do know that they are freely available, they are accessible, and the most commonly one that is available is condom use.
Okay. Well,
condom as a method of contraception.
All right, let's hold it right there because we're going to come back to this. But I want to introduce Whitney Chirongwenya because she just joined us, among others. Now, Mary Stopes Clinics, where people know Mary Stopes Clinics as that place that you go to when you want to have an abortion or if you choose to terminate your pregnancy. Just tell us about Mary Stopes. What do you guys do?
Okay, so Mary Stopes is a non-profit organization, and we provide sexual and reproductive health care services.
And what does that mean in simple terms? Yeah?
It's not just safe abortion services. We also provide contraception, and we provide women wellness services, which means pap smears, STI screening, HIV testing, the works.
Okay.
Yes.
So you say you're an NGO, but do people pay for your services?
Yes, people do pay. We have a cross-subsidized system.
Yeah.
So we have a footprint of 14 centers across 7 provinces.
Yeah.
So let's say our clients in our Sandton Center pay slightly more for the same service as our clients in the Soweto Center.
Why is it?
So that they can help to subsidize the service for Soweto residents that can't quite afford it at that price, but need access to the service.
All right. Okay.
Yes.
Okay. All right. We'll get back to you, but maybe let's just get back to your issue around various methods of contraception. And the first one you mentioned is condom use. How safe is condom use in terms of preventing pregnancy?
Condom is more than 90% safe if used properly and consistently, not intermittently. So you have to be using it with every encounter with your male partner. Then it is very safe.
Okay.
The advantage with it is you will benefit twice. You will not fall pregnant and you will not contract sexually transmitted disease.
Okay. Of course, the main one being HIV that we worry about, obviously.
Yes.
Okay. What other, you said that you provide a variety of contraceptive services. What do you provide?
We have them in 3 segments.
Yeah.
So we have the long acting, which is your IUD and your implants. And then we have your short acting, which is the pill, the injection, the patch, the condoms. And then we have permanent methods, which is your vasectomies and sterilization. So it's a wide variety that anybody can choose from.
Okay.
So I think it's important to note that contraceptives is not a one-size-fits-all. Different things work for different people.
Right.
And once people try something and it doesn't work for them, then they go off the contraceptives instead of trying something else that might work better for them.
Okay. Sister, I mean, you deal with a lot with people that come requesting termination of pregnancies. What then do you do afterwards in terms of, advice on family planning and contraception? That's the one part. But before that, what sense do you get from these people? Is it people that did not use any form of contraception in the first place? Or what is the actual situation? Or do you ever go into the reasons why they fell pregnant in the first place?
Yes, doctor, we do. Some women have used contraceptives before they fell pregnant.
Yeah.
before they landed to us for termination of pregnancy. But they will tell you they've suffered side effects of the contraceptives, and then they decided to stop. As the doctor had said before, once it fails, the method that one is using, once it fails, they don't go back to the clinic to say, this is not working for me, I'm suffering these side effects. They decide to come off completely.
Okay. Well, Dr. Makua, there's clearly a problem. And this is, stuff that leads to the problem that we're talking about in the first place. So it appears that the advice or the management of, contraception at these family planning centers sometimes may not be adequate, because it's unacceptable that somebody, stops because of side effects and is not counseled around the issue of side effects. Your comment?
Yes, I agree that if you don't understand what is actually happening, automatically what we would then do is just to stop using the method. But from the Department of Health, we've got partners, a lot of partners who are actually strengthening the counseling and the information around the use of contraceptives. Okay. And we would like to urge our community to say, if one method is not working for you, we've got more than enough choices. So try until you get to the last choice before you can stop using any method. Okay.
And lastly, you're saying that you have lots of choices at no cost.
At no cost.
And there's never a time when you're out of stock on these things.
That's one pride we have. We are always having commodities.
All right. Okay. You provide the same, but at cost.
Yes, it is at cost.
And if you live in Soweto, you pay a little less than someone who lives in Sandton.
Yes, but for our contraceptives, though, it is the same price, minimal price everywhere.
Okay, yes. All right, okay. I believe we have another caller on the line, Mohammed.
Yes, good day, sir. I hope you all are well. My few questions that I have, and what I need to find out from you is pregnancy, to terminate the pregnancy. From what I had learned and from what I had been taught, the mother actually is the murderer of the very baby that she carries. Maybe it was planned or unplanned, and that child actually runs up to the mother for sort of a help, and the very same mother is the one that is actually terminating or rather murdering her child, her future child. Now, maybe at that time, for her instance, maybe it is fine that she finds it acceptable, but what remedies are taken to actually remedy the psychological effect the mother goes through ahead in her life? Maybe 5 years, 10 years later, it kicks in to say that the very child I have murdered or I have killed a child, and it does take effect. So my question is, what remedies are taken into place on the psychological effect of the mother that she goes through, which is the most important, and it virtually ends up in a depression state, and those can have very dire impact on her breaking up her home, or she's getting into other sort of difficulties in life.
All right. Thank you very much, Mohammed, for your very, very interesting question. And if you don't mind, we'll deal with this question after the break. Okay. So if despite the fact that contraception is available and someone ends up with an unwanted pregnancy, what options are available for such a person? Stay with us, because we find out the answers after the break.
Welcome to Network, a technology news program that also discusses what's trending in social media in and around Africa. MTN has launched its new movie and television streaming service, Front Row. If it's trending, we will find it. That's Network with me, Spumelele Zondi, every Sunday at 7:30 p.m. only on the SABC News Channel.
Welcome back to Health Talk once again. Now, controlling fertility through, for example, contraception is an integral part of any young and sexually active woman's life. Now, interventions in fertility can, for a variety of reasons, frequently only happen after conception. Now, this then means the question is not whether or not, the woman will try and end the pregnancy, but how that pregnancy will be ended. Will it be the safe abortion or the unsafe abortion? So, for now, we're going to explore the safe abortion route. But before we get back to our guests, we had Mohammed who asked his question around psychological support. Now I believe we have Luande on the line from Devon. Luande, good morning and welcome to Health Talk.
Good morning, Doc and the crew.
Yes, ma'am. Your question or comment?
My comment, Doc, is on the attitude of the healthcare workers. I think the Department of Health has to work very hard on that. For instance, combining both issues, the contraceptive one and also the unsafe abortion, you'd find that these young teenagers, when they approach these healthcare centers, there is a healthcare giver who's saying, I'm going to tell your mother you have started to be sexually active and all those things. So those things, they make these kids to run away to get the proper contraceptives at the right time. The same goes with abortions. If that caregiver has told that teenager that he's going to tell the mother because he's sexually active and is looking for contraceptives, so the same thing will apply when she's coming for the safe abortion, that the whole matter is going to be a public issue. So professionalism is really needed and a good attitude.
All right. Thank you very much for your comment, London. Very valuable comments we're getting from our viewers there. Now, first up, let's deal with Mohammed's question. I'm not going to deal with the first part about the mother killing the baby because that's its choice and so on. Let's deal with a very important aspect that he's raised around what psychological support is given to women after TOPs. Perhaps let's give you a bit of a break, Dr. Makua, and talk to the people that actually, are involved in this. Sister, what psychological support are given to these young women after a TOP?
Not only after, even before.
Right.
When the woman comes in to request termination of pregnancy, she does get counseling. Yeah. We have social workers in the hospital that deal with that. They deal with the emotional state and the readiness of the woman to terminate her pregnancy. And then they're given options as well. Like, for instance, if termination is not an option for her, there's adoption. They're told about adoption. She can give the baby up for adoption, and foster care.
Okay, but is there a period where they, get followed up, they get support even after the actual procedure?
Yes, even after the procedure, they do get post-TOP counseling.
Okay.
Yes, if there's a need, she will always come back for more sessions until she's okay.
All right.
But most of them get very relieved after the termination of pregnancy.
Okay. What is the situation with Mary Stopes?
I think just to add on to what Sister Sharon is saying, if a woman has been counseled before and they are 100% sure of the decision to terminate, they are barely ever traumatized after the procedure. So they will not be in need of any counseling. But at Mari Stopes, we do have a client services center, an 0800 toll-free number, and our clients or non-clients are free to call us at any point, whether it's psychological and medical aftercare that they need.
Okay, we're going to show that number at the end. Okay. But let's deal with Luande's question now around, and I mean, she used the word professionalism, and I guess it goes back to that stigmatization that I spoke about. The type of service that women, needing contraception get at the facilities. Maybe let's still stick with you two. Sister?
Can you repeat your question, please?
Well, yeah, it is about, if you listen to what Lwande was saying, sometimes there's no privacy when they get counseled around the issue of contraceptive tablets, and somebody else might actually see that they're getting contraceptive tablets, and they might say, oh, I'm going to tell your parents that you're now sexually active because you're coming to get, contraceptive tablets, or for that matter, to come and ask for a TOP. And that's one of the reasons that drives these youngsters, to the back street, as it were.
Yes, sometimes I do get such patients with such an explanation to the unwanted pregnancy. Mostly it's teenagers.
Yeah.
The young girls.
Yeah.
Yes, they will tell you about the attitude of staff in the clinics.
Yeah.
But it's very unprofessional.
Okay. Well, maybe I must invite your comment, Dr. Makua.
Yes, I think this is also an opportunity to share with the public the initiatives that are there in the department, because we do have youth-friendly service initiative.
Yeah.
And most often it's offered with partners and with the Department of Health directly, where we say, as young people, sometimes it's true, it's about attitudes, but also sometimes it's about their space, because as a young person you are in a different space with adults. Whatever that you hear from adults might be misinterpreted or might be misled, might mislead other people to say I was mistreated simply because you were asked of your request.
Yeah. But I think we need to take these comments quite seriously, because there's room for improvement, and try and improve our service. But before that, now let's take Karim on the line from Glencoe. Hello, Karim.
Hello, how are you?
Good, how are you? Your quick question and comment, please.
I'm sorry, I just came on late. I put my TV on now and I see the program is on. What I would like to know is, what is a good contraceptive to use? We are both 42 years old, and all along we've been using the condom.
Okay, all right. Thank you very much, Karim, for your question. Let's give it to the sister. 42-year-old couple. They're talking about what sort of contraception to use. Or do you want to take it, Dr. Maku?
Yes. The first question would be, what is your plan? What's your plan?
Well, clearly they don't want to have babies. They're both 42.
If you are 42 and your woman is 42, you can opt for permanent methods, which it could be surgical methods.
Okay.
But there's nothing wrong in continuing to use
the condoms.
The condoms.
Okay. All right. Okay. A short answer. Now, let's come back to, we promised to talk about the actual safe procedure. Let's start with you, Whitney. Take us through the actual procedure now. Somebody coming to opt for a safe abortion route. What do you take the person through?
Okay, so the first thing that they go through is a pregnancy test to confirm that they are pregnant and their gestation. And then after that, they go through a counseling phase where they are given the options that Sister Sharon was talking about. Adoption, continuing the pregnancy and parenting, as well as abortion. And then they're given their two options, which is the medical and the surgical options, and they pick one.
And then?
And then once the procedure is done, they are in our clinic for the surgical, for example. They are in our clinic for the day, and then after they leave, they are free to call or come back in at any point should anything happen, whether it's medical or psychological.
And you spoke earlier about a number that they need to call. We've now displayed it on the screen. It's 0800 117785.
Yes, that's correct.
All right. Now, what can a person expect in terms of the procedure? I mean, when you see some of these ads, they talk about painless and safe. Is it painful?
It is. There is a discomfort to it. So for the medical, which is the pill, it displays similar symptoms like the miscarriage. So you bleed out and it does hurt. So does the surgical. And by surgical, they don't actually mean they cut someone open. It's actually a gentle suction procedure, so it's not as invasive as cutting somebody.
Yeah, but the key message in all of this is that it is safe.
It is safe.
And things are unlikely to go wrong.
Yes.
Well, I'm afraid that's all we have time for. It's been a fascinating discussion. Thank you so much for your contribution, Dr. Makua, Director of Women's Health and Genetics at the National Department of Health in South Africa, Sister Sharon Peter, midwife at Charlotte Maxeke, and Whitney Shilongwenya, Communications,
Marketing and
Communications Coordinator for Murray Stokes.
Yes.
Thank you, ladies.
Thank you.
Thank you very much.
All right. As I said, that's all we have for you today. Remember that you can catch us again later on at 2 o'clock and 10 o'clock during our repeat shows. And remember, we extremely value your comments. Please send these to us. Share them with us on our Facebook page, SABC Health Talk, and tick. And you can follow us again on Twitter at SABC Health Talk. And again, drop us an email, healthtalk@sabc.co.za. So from me, Dr. Sello Mutaung, and the rest of the crew here at Health Talk, thank you so much for watching. Take care and see us next time.